3,222 people have tested positive for COVID-19 in the latest 24-hour reporting period. The NICD says this represents a 16.7% test positivity rate, which is 3 times the rate at which the spread of the virus is considered to be under control. Now, the NICD says another 5 deaths have been reported, 2 of which occurred in the latest 24 to 48-hour reporting period. 100,303 deaths have been recorded in South Africa from COVID-19. Active cases have increased to over 29,000. Meanwhile, senior researcher at the CSIR, Dr. Ridwan Suleiman, says there has not been a significant change in reported COVID-19 hospitalizations in Gauteng, despite a substantial increase in infections. However, Suleiman has warned in a tweet that it is too early to assess the severity of infections at this stage. He says the 7-day average of infections in Gauteng is up by 88% week on week. Now, South Africa has reported a notable increase in COVID-19 cases, raising concerns that the country could be seeing the start of the 5th wave. The rise in cases appears to be linked to the new BA4 and BA5 Omicron subvariants. The NICD indicated that the country's coronavirus test positivity rate climbed to the highest in more than 3 months. Now, to discuss this further, we're now joined via Zoom by Deputy Vice-Chancellor for Research and Innovation at Northwest University and former member of the Ministerial Advisory Committee on COVID-19 Vaccines, Professor Jeffrey Mphahlele. Professor Mphahlele, thank you so much for your time. Now, Prof, are parts of the country already in the 5th wave of COVID-19 infections, or are we seeing the first signs of a possible turn for the worse in the coming weeks?
Thanks for having me. In all likelihood, this is the beginning of the 5th wave. But I think we shouldn't be too concerned at this stage. And I would say we shouldn't be too concerned for at least 2 reasons. The fact that for now, the sublineages, the variants of Omicron that we are dealing with. These are the sublineages of the Omicron that circulated around the festive season, and it has, to a large extent, created or induced protection in number of people. But then I think that said, I'm not saying that we should not be vigilant. We should be vigilant, but even if we get increased cases, this should not translate to more severe cases and, increased number of deaths.
Now, that is very comforting to hear, Prof. But what do we then make about the fact that we are currently sitting at 16.7% test positivity rate, which is 3 times the rate at which the spread of the virus is considered to be under control?
Yes, I think it's related to the fact that at the beginning of the pandemic, we were really advocating the concept of herd immunity. But we now know that we may not be able to reach herd immunity with SARS-CoV-2. So far, we had a number of variants circulating. This Omicron variant that is circulating now, I think, is the 5th a variant of concern that is circulating. So it goes to show that we may not be able to achieve the concept of herd immunity in a number of cases. What that means is that we can't stop infections because neither vaccines nor natural infection is able to prevent infection or prevent transmission to other people if you are infected. So that means that we will see increased cases if BA4 and BA5, start to transmit rapidly in the population. And that is just a natural phenomenon because we can't stop infection. The vaccines are not meant to stop infection. They are meant to actually give us protection from severe disease and ultimately deaths.
Now, talking about that protection, scientists are studying that BA4 and BA5 variants, in fact, to see if they've mutated in any way. To what extent will this be able to reveal whether or not the virus has increased the ability to evade previously acquired immunity?
Well, usually those experiments are pretty much precise. So they should be able to tell us whether BA4 and BA5 can escape either natural immunity or vaccine-induced immunity. But as I said, most likely we shouldn't expect really a wide or maybe a real escape from protection, whether it's a vaccine or natural infection, simply because we're dealing with, just the cousins of Omicron. So these are the sublineages, and largely we should be, protected, even if we are not fully protected by the immunity that was induced by Omicron when it was circulating, or the immunity that is induced by the vaccine.
Would you then encourage people, those especially that are due to get their booster shots? I mean, also looking at the fact that we are going into a winter, there's also other illnesses that, get thrown into the fray, including a flu.
So because these cases are going to happen now during the winter season, most likely the increased cases could be due to more people seeking medical attention because they've got flu-like symptoms. And obviously, because there is an overlap with the symptoms of flu and COVID-19, people, when they've got symptoms, they might be worried about COVID-19, and then they will seek, testing for COVID-19. And that could actually increase the number of cases that we see during this winter period. But even if that is not happening, I think the message and the narrative is that if we don't get any brand new variant, which is not closely related to Omicron or to previous variants, we should not be too worried in terms of the variant causing severe disease as well as, hospitalization.
If we have to look at just some of the changes that were done just recently as far as it relates to the mask mandate, would you then encourage people to, change behavior probably back to where we've seen when we were in severe lockdown? Because as it currently stands, there is no need for you to be wearing your mask outside. Is there a significant change that is needed, or would you say that we shouldn't worry ourselves too much about that?
Well, if there's something that I'll continue to do, is to wear masks, and wherever I feel not safe, even if for now we know that the masks are mandated for indoor environment that is poorly ventilated, I would wear a mask even if I'm not really indoors and I feel not secured, because masks will always add extra layer of protection in terms of acquisition of the infection. And it's not just about COVID-19. These are all kinds of infections, especially respiratory infections, including influenza, and also transmission of the virus to other people if you are infected. So there is always a benefit of using a mask, as long as you use the mask that can properly fit, your face. There's no point using a mask that is loose and is not really protecting your respiratory system.
Prof, before I just let you go, just one of the issues that came out was the fact that there has not been a significant change in reported COVID-19 hospitalizations in Gauteng, despite a substantial increase in infection. The people that are currently being hospitalized, as research is starting to show, who are they? Are we still talking about those that are still unvaccinated, or are we looking at a mixed bag at this point?
is largely unvaccinated people. So this shows that obviously there is a benefit of vaccination, and this is the reason we are promoting and encouraging people to get vaccinated. So by and large, these are really people without any form of protection, especially non-vaccinated individuals.
Fantastic. Prof, thank you so much for your time this afternoon. Appreciate it. Professor Jeffrey Mphahlele, and he is he's the Deputy Vice Chancellor for Research and Innovation at Northwest University and former member of the Ministerial Advisory Committee. More news when we